Hi, Dr. Jackie.
Hi.
So, what are some signs and symptoms that someone who's thinking about preconception should pay attention to in your clinical experience?
So we have some obvious symptoms. Generally, when we're thinking about preconception, we're thinking hormones, we're thinking menstrual abnormalities, and when we are talking about menstrual abnormalities, especially in this clinic, we're often talking about symptoms that are considered normal that aren't actually normal. This can include spotting before you have your full bleed or in between your bleeds. It can also be PMS symptoms, breast tenderness and swelling, menstrual migraines. It can be digestive distress during your menses. These types of things are things that we should really be paying attention to and dive deeper into prior to starting the journey and trying to conceive. And then we have other things that we might not even consider, like having a heavy environmental toxin load burden. And that can look like abnormal skin rashes, a lot of fatigue. Also in that kind of same pattern of symptoms are deficiencies. So here we do micronutrient testing, macronutrient testing, where we're focused on making sure that you are fully replete going into the journey of preconception.
Awesome. So, if you were just talking to someone who was generally interested in preconception, what are just some general tips you might give that person?
So we would definitely be talking about what type of contraceptives they had been using, how they're tracking their cycles, if they're going off of symptoms, what those symptoms specifically mean, as well as tools that they can use during that time. We would go through what supplements they're currently taking, what labs they've had done more recently, and which ones we should repeat while they go into this time where they're actively trying to conceive. And then going through some of the basics in regards to nutrition and hydration, as well as stress,